Washing your face seems like one of the simplest things a person can do. You wet your face, apply some cleanser, rinse it off, and dry it. Most people have been doing this since childhood without ever giving it much thought, operating on the assumption that as long as the face feels clean afterward, the job has been done correctly. But dermatologists consistently point to face washing technique as one of the most commonly misunderstood aspects of skincare, and the consequences of getting it wrong show up in ways that most people never connect back to something as simple as how they wash their face every morning and night. The reason face washing technique matters more than most people assume comes down to the skin barrier. The outermost layer of skin, called the stratum corneum, functions as a protective barrier between the body and the outside environment. This barrier is composed of flattened skin cells held together by a matrix of lipids, essentially fats, that fill the spaces between those cells. This lipid matrix is responsible for keeping moisture inside the skin and keeping irritants, bacteria, and environmental pollutants outside. When the skin barrier is intact and functioning well, skin tends to feel comfortable, look relatively even, and respond reasonably well to skincare products. When the barrier is compromised, the consequences can include dryness, tightness, increased sensitivity, redness, a paradoxical increase in oiliness as the skin tries to compensate, and a greater tendency toward breakouts and irritation from products that would normally be well tolerated. The direct connection to face washing is that almost every aspect of how most people wash their faces, the water temperature they use, the type of cleanser they choose, how long they cleanse, how they rinse, and how they dry their face afterward has the potential to either support or undermine this barrier. And because most people repeat the same face washing habits twice a day, every day, even small mistakes in technique compound significantly over time, creating cumulative barrier damage that builds up gradually rather than appearing all at once. Water temperature is one of the most immediately impactful factors, and it's one where the most common habit happens to be the most damaging. Hot water feels satisfying on the face, and there's a persistent belief that hot water opens pores and helps cleanse more deeply. Neither of these ideas is accurate. Pores don't actually open. And close in response to temperature, they don't have muscles that allow them to do this. What hot water actually does is dissolve and strip the lipids from the skin's barrier more aggressively than cooler water does. The same property that makes hot water feel like it's cleaning more thoroughly is what makes it damaging to the barrier. It's too effective at removing oils, including the natural oils that the skin barrier needs to function. Over time, regular use of hot water to wash the face can leave the skin chronically dehydrated, tight, and sensitized, with a barrier that never fully recovers between washes because each wash strips it down again before it can repair itself. Cold water, while less damaging than hot water, doesn't offer the dramatic benefits that cold water proponents sometimes claim either. The idea that cold water tightens pores is similarly inaccurate for the same reason pores aren't capable of physically changing size in response to temperature. Cold water simply causes a temporary looking change in skin surface texture that reverses quickly once the skin returns to normal temperature. The general recommendation from dermatologists is lukewarm water, warm enough to effectively remove cleanser and help it work against oil and surface debris, but not so hot that it aggressively strips the lipid barrier. This is a simple change that, applied consistently over weeks and months, can make a noticeable difference in how the skin feels after cleansing. The cleanser itself is the second major variable, and the range of cleansers available makes this more complicated than it used to be. The soap bars that were once the default for face washing are now broadly considered by dermatologists to be among the harsher options for facial skin. Traditional soap has a high pH relative to the skin's natural pH, which is mildly acidic, and washing the face with a high pH soap disrupts the skin's acid mantle, a thin protective film on the surface of the skin that plays a role in maintaining barrier function and protecting against certain bacteria. Modern facial cleansers, particularly those marketed as pH balanced, are formulated to be closer to the skin's natural pH, which is a meaningful improvement over traditional soap from a barrier preservation standpoint. Beyond pH, the type of cleanser matters significantly depending on skin type. Foaming gel cleansers tend to produce more lather and are generally more effective at removing excess oil, which makes them a reasonable choice for people with oily or combination skin. However, this same oil-removing effectiveness can be too stripping for people with dry or sensitive skin, leaving them feeling tight and uncomfortable after cleansing. Cream and lotion cleansers are gentler and more hydrating in their formulation, making them better suited to dry or sensitive skin types, but they may not feel sufficiently cleansing for people with higher oil production. Micellar water, which uses tiny micelle molecules to attract and lift dirt and oil without requiring significant rubbing or rinsing, is particularly gentle and well tolerated by sensitive skin, though it may not be sufficient on its own to remove heavy sunscreen or makeup for people who wear both. The length of time spent cleansing is another factor that doesn't get enough attention. Many people spend either too little time cleansing, applying cleanser and rinsing almost immediately, which doesn't give the cleanser enough contact time to effectively remove surface debris and excess oil, or too much time, massaging cleanser into the skin for several minutes, which can cause unnecessary friction and overstrip the barrier. A cleanse time of around 60 seconds is the general range dermatologists tend to suggest as a reasonable balance, enough time for the cleanser to do its job without prolonged contact that increases the risk of stripping. The technique used during cleansing also matters more than people typically assume. Aggressive scrubbing with fingernails, a rough washcloth, or a highly abrasive physical scrub on a daily basis creates mechanical friction that can damage the skin surface and contribute to barrier disruption over time. Gentle circular motions with clean fingertips or the careful use of a soft silicone cleansing device are generally considered more appropriate for daily cleansing than anything that involves significant physical friction against the skin surface. This doesn't mean physical exfoliation is never appropriate. It can have a place in a skincare routine for certain skin types, but using it as part of every single daily cleanse is a different matter from occasional intentional exfoliation. Rinsing is a step that often gets rushed, but inadequate rinsing leaves residual cleanser on the skin, which can be irritating over time, particularly for people with sensitive skin. The face should be rinsed thoroughly enough that no soapy residue remains, which typically requires more rinsing than people think, especially around the hairline, jawline, and sides of the nose where cleanser tends to accumulate without being obvious. At the same time, excessively prolonged rinsing with running hot water returns to the water temperature problem mentioned earlier, since extended contact with hot water is more damaging than brief contact. How the face is dried after washing is a step that is almost universally underestimated in its impact. Most people rub their face dry with a towel in the same way they might dry their hands, which creates friction against skin that is temporarily more vulnerable immediately after washing, since the skin surface is wet and slightly softened. Patting the face dry gently with a clean, soft towel is the approach dermatologists generally suggest, allowing some residual moisture to remain on the skin rather than completely removing every trace of water before applying moisturizer. This residual moisture, sealed in by a moisturizer applied while the skin is still slightly damp, can help support hydration levels in the outer skin layer more effectively than applying moisturizer to completely dry skin. The towel itself is worth thinking about, since a towel that is used repeatedly without being washed regularly can harbor bacteria and other microorganisms that get transferred to freshly cleansed skin. This is particularly relevant for people whose skin is prone to breakouts, since introducing bacteria to clean skin immediately after washing somewhat defeats the purpose of cleansing. Using a clean towel or a designated face cloth that gets washed frequently, or using single-use facial tissues for drying, are practical alternatives that eliminate this specific risk entirely. Cleansing frequency is another area where common habits don't always align with dermatological guidance. Most people wash their face twice daily, in the morning and at night, and this is generally the standard recommendation for people with normal to oily skin. However, for people with dry or sensitive skin, twice daily cleansing can be more than their skin barrier can comfortably tolerate, particularly if combined with other active ingredients in their routine. Some dermatologists suggest that people with very dry or sensitive skin could consider rinsing with plain water in the morning rather than cleansing with a product, reserving full cleansing for the evening. When the goal is to remove sunscreen, makeup, pollution, and the day's accumulated skin oils, this reduces the total number of times the barrier faces the disruption of cleansing while still ensuring a thorough cleanse at the end of the day when it matters most. The timing of applying moisturizer after cleansing connects directly back to the goal of avoiding stripping moisture. When the skin is left to air dry completely before a moisturizer is applied, some of the natural moisturizing factors in the outer skin layer can evaporate along with the surface water, leaving skin slightly drier than it was before. Applying a moisturizer while the skin is still slightly damp within a minute or two of patting it dry helps trap that residual surface moisture against the skin before it can evaporate, and this small timing adjustment can contribute meaningfully to how comfortable and hydrated skin feels throughout the day, particularly for people who already tend toward dryness or tightness after washing. There's also a broader point worth making about how much variation exists between individual skin types and how the right approach to cleansing isn't identical for everyone. Someone with oily, acne-prone skin and someone with dry, sensitive skin have genuinely different needs when it comes to cleanser type, frequency, water temperature, tolerance, and how aggressively or gently they should be cleansing. General guidance provides a useful starting framework, but paying attention to how your own skin responds after cleansing, whether it feels tight, comfortable, overly oily, or irritated, is important feedback that should inform whether the current approach is working or needs adjustment. Skin that consistently feels tight or uncomfortable after washing is giving a fairly clear signal that the cleansing routine is too stripping, while skin that feels consistently congested or not clean enough may need a more thorough approach. The reason all of these specific, seemingly small details matter is that face washing isn't a one-time event. It's something most people do 700 times a year or more. A slight improvement in technique, applied consistently across that many repetitions, has a genuinely cumulative positive effect on barrier health over weeks and months. Conversely, a consistently damaging technique repeated that many times creates cumulative damage that most people experience as simply my skin type rather than recognizing it as the product of a fixable habit. Understanding the biology behind what face washing actually does to the skin makes it possible to approach even this most basic skincare step in a way that works with the skin rather than against it, which is ultimately the foundation on which everything else in a skincare routine either succeeds or fails.